And she felt so much better. So much so now that she's talking to all the patients about it. She's like, you gotta do this. This is why I feel so much better. So for me, it's when it's transformative in a way that even without you, they're helping others.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Mary Martinez Coffey, who is the founder and clinical pharmacist of Boutique Wellness in Winston-Salem, North Carolina. She holds double board certifications in clinical nutrition with her fellowship from the American Academy of Anti-Aging and Regenerative Medicine. She's also a member of the American Society of Consultant Pharmacists. Now, Mary partners with her patients and guides them towards their health goals. She believes in getting to the root cause of illness, empowering them to heal themselves. She treats patients with varying conditions by optimizing the use of medication through genetic testing and enhancing care through nutrition, supplementation, exercise, and mindfulness. So Mary, welcome and great to have you here on the show.
Thank you so much for having me. I appreciate your time.
Yeah, so I know within your practice, you have kind of two areas. You have the aesthetic side and then you have the wellness side. But how did you get interested in medicine in general?
In medicine, as in general, I always knew I wanted to be in medicine.
Okay.
Ever since I was 14, it just hit me. You're like, okay, I'm going to try to be a doctor. So I took pre-med. I did pharmacy as my pre-med and finished up pharmacy school in about 6 years. And I said, you know what? This was back in 2000. I graduated from the University of St. Thomas in the Philippines, actually, and just decided to go back to the States and pursue pharmacy for a while. And here I am. And I started practicing pharmacy for about 15 years. And I didn't agree with the practice, right? So I went back to school and got my fellowship from A4M, the American Academy of Anti-Aging and Regenerative Medicine, got my certification in clinical nutrition, and fell in love with integrative healing or integrative medicine, getting to the root cause. I've always loved nutrition. Always been an athlete also my whole life. So I've always kind of, embraced myself around just being active and just a whole lifestyle. So then when I added nutrition and micronutrients into it, it just enhanced everything. Got into peptides probably about 2017, 16, really started diving into regenerative medicine. And then I met actually Dr. Joe Cleaver back in 2019, and he introduced me into aesthetics. So then I added aesthetics. So I opened up my practice, left pharmacy, opened up my practice 2018, just left pharmacy. I'm like, I'm going to do this. And I started integrative medicine. And I started with hormones, bioidentical replacement hormones. And then I did, I did drug-induced nutrient deficiencies. I did a lot of medication therapeutic management. But I needed more. Like, it's really hard to survive in that industry without adding aesthetics. So luckily I met Dr. Joe just at the right time after opening my practice a year. And then we added just to support neurotoxins and some threads. We're actually number one threads, Google Threads in North Carolina. We're like probably number one in this area because Dr. Joe and I were probably the first to really start advertising that. It's the number one searched aesthetic procedure on Facebook, believe it or not. So started adding video threads. We were booked solid. And then I'm like, you know what? I need something that's kind of non-invasive, something that you can use a device for. That I got all the BTL devices, M-Sculpt Neo, M-Face. I got all the M-Cellas. Now I have Cellutone, and then started to get into the lasers. And now I love aesthetics. So people come to me for neurotoxins, but I now can talk to them about nutrition, talk to them about their hormones. When they're coming in for a Dysport or Botox, I'm able to really talk to them about other things that they were not expecting. So they come back and we end up, doing labs and maybe looking at some of the medications they're on and really fine tuning and doing personalized medicine here. So this is a practice that's kind of different than any other practice in the area that is a typical med spa. So it is really truly mind, body, and spirit, which is for me the highest form of healing. So I never forget to integrate that approach as well. That's actually the foundation of how I got to where I am, is integrating all three.
Got it. So what kind of led to you opening up boutique wellness? Was it something that you just always knew you wanted to have your own practice, or something that happened like as you were learning all these different areas that you're like, okay, it just makes sense for you to want to open up your own practice?
Well, I always knew I've always been an entrepreneur. I came from a family of entrepreneurs. My dad had a very successful accounting business in New York. I grew up in Long Island. Went to college in the Philippines. We grew up in New York. My dad, had his own business. My mom had her own business. My grandmother did. So it was in my bloodline, right? So I always wanted to improve businesses, right? And oftentimes people don't want to hear it. You're an employee. They don't want to hear that things can be done better. They just want you to work. So I just knew, and my ex-husband was like, no, we're just going to work. We're just going to work for collect the 401k. I'm like, no, I want to work for myself, So I took the leap, and I know what I want in a med spa or in a clinic for myself. And I just incorporated it into my practice. So pretty much what you see when you walk into our practice is me. I was fortunate enough where I was doing the Botox and Bubbly party here. Remember, February 4th, it's like 2022. Fell in love with this house, and hopefully you'll see it if you look at the website. And it just came about that it was available. So this whole house it's a center of healing, because it's a restaurant downstairs too. We do boutique wines. We do really nice Roman style pizza. So I have a restaurant downstairs too. All of this just kind of happened organically. So when you asked, did I want to open my own business? No, everything just kind of happens. You just go with the flow. When you're in alignment, things come to you, and they come fast. And I just stay open. And the key, I guess, for me to the success is just staying open and being open and adaptable to change.
Got it.
Does that answer your question?
Yeah, it definitely does.
Long-winded.
Yeah, no, it's good. It's good. So I feel like your practice has kind of been on the cutting edge. Like, you talk about regenerative medicine, you talk about nutrition, wellness, aesthetics. And it sounds like you kind of got into these before a lot of other aesthetic practices got into. It almost seems like you kind of led with the regenerative medicine side first, like
Correct.
the physical medicine side first, which is a little bit in the aesthetic space, because I see most medical spas starting with aesthetics, and now more recently, within the last 1-2 years, introducing regenerative medicine. But what are you excited about with the new treatments, emerging treatments across all these spaces? Regenerative, functional, aesthetic, everything. Like, what's really getting you excited?
Oh God, so much. It's natural healing. It's the way we're intended to heal, right? When you think of regenerative medicine, I think of, for me, aesthetically, building collagen 1 and 3. Now I just bought a new device. Actually, it's called Blood Duo, and it utilizes argon gas as well as nitrogen gas emitting plasma. So not only does it regenerate, build collagen 1, but you're also building collagen 3. There's nothing in the market that does that. So because we love regenerative medicine, it just flows with everything we offer. We started with regenerative medicine, yes, with peptides, some stem cells. Now stem cells, I think, are illegal in Florida and in Texas, but we use plant-based stem cells, which are FDA approved. We use stem cells now for hair restoration, and let me tell you, we're getting amazing results. So I would say, yes, sometimes we've used some filler, but we've had too many people that have had adverse reactions, being it moving, and it's temporary. Yes, I do toxins, and I think toxins are great for fine tuning, but it's not a long-term fix. So I've always been fascinated with getting to the root cause of why we're sick. What can we do? The way God, for me, I'm very close to God. I'm like, why are we here? Like how can we heal the body? And I know God gave us plants to heal, and we're here to, I'm just kind of facilitating, that natural healing.
Okay, so with all these different treatments that you're offering, all these different modalities, how do you approach educating your patients on what you do and the benefits of these treatments? 'Cause I'm sure that some people may know a little bit about it, but I'm sure you get a lot of people who have no idea what any of this is. So how do you approach that education side for your patients?
I always give them a handout. I never tell them what to do. My favorite patients are the ones that go home. They're biohackers, right? They go home, they research. I turn them into biohackers, right? I'm like, start researching this, start YouTubing this, look up this peptide, or therapy. And that's how I educate my patients. I give them names. They always ask me, like, okay, what can I do? What are some things that I can do that can help, heal the tissue? What are some things that I can do for my gut? If I do an initial consultation, oftentimes they're here for aesthetics, or they're here for hormones, or for weight loss. Those are our main things that people come in for, or hair restoration. But oftentimes I ask, through the questions, I try to get to the root of why they're having hair loss, and I explain to them, like, well, unless we treat the underlying cause, for instance, the number one cause of hair loss is DHT, right? Too much dihydrotestosterone. Testosterone converts to that. How do we block that? If we don't know those numbers, we can get you to get hair, but it's going to just come right back. So that's number one, right? So for me, patient education is number one. It's knowing yourself, knowing your body, being educated with your own numbers, and educated with the labs that are available, the services, the treatments that are available. That way, when I'm telling you these things, you're not just doing what I say, because that's the last thing I want. I don't want to be the boss. I want you to be the boss, and I empower my patients. Every single one of my patients, I want them to leave this place more educated and empowered, knowing and being and just following their gut, right? Because oftentimes they know something's off, but their doctor's like, I just had a patient this morning. She's like, everything's normal. And her sex hormone binding globulin was like 93. I'm like, no, that's not really normal. Usually it's elevated when there's toxins, or, you're not converting that total to fat to that's active form. And she didn't want to hear that, but she's like, well, everything's normal. I'm like, yes, everything's normal, but do you feel okay? And that's what I try to tell them. Like, you need to trust yourself. The lab values may be normal, but you know what? They're comparing that to our 73% obese nation, or our sick nation. I don't want to be in that normal range. I want to be in the highest optimal range, right? So I try to explain to them that my ranges, number one, are different, but also don't chase numbers. Listen to your body. Something's off. So it's slow. So like you said, some people get it, some people don't. You meet them where they are. And then when they're ready, they come to you. But I give them homework. Say, go home, research this. And I always try to meet them with where they're comfortable versus bringing them to where I am. Like, she just wanted something all natural. I'm like, okay, and I can do that. It's going to take more time, but you want to always do something that matches them. Otherwise, they're not going to be compliant. Mm-hmm. And that's what I've learned over the years. So I hope that helps.
Yeah, definitely. And you brought up a really good point as far as fixing the root cause, because I think what most people think about when it comes to medicine, it's, oh, I have this symptom, get me something, get me a pill, get me a drug, get me a surgery that's going to fix this symptom. But very few actually look at what's the root cause. Kind of like you mentioned of hair loss. It's, oh, I'm losing my hair. What can I do to grow it back? But okay, why are you losing it in the first place? So right. I think that's one big area that people really don't think about. Like, especially in medicine, it's you would think it's just common sense, but I think it's the way that medicine is kind of evolved, or I guess I can't speak about other countries, but in the US, it's almost like there's incentive to keep you sick or paying for something just to keep fixing the symptoms, not the root cause. But I really think that regenerative medicine and just functional medicine and even biohacking is really about fixing that root cause so that you don't experience it hopefully ever again, right?
Right, 100%.
Yeah. So I want to talk a little bit more about kind of what differentiates your practice from the other industry. And I think just the type of services you offer, the background that you bring is a big differentiation. But what would you say are some other differentiating points that kind of really separate you from others?
Well, definitely from another med spa. I really try to approach from a holistic view, treating the whole body versus, the skin. Skin's an organ, right? If they're aging in their skin, obviously there's elasticity issues, the collagen issues, there's maybe absorption issues. So I always try to, look to see, well, why is their skin aging so fast? Should they be on hormones? That's number one. Are they, do they have a leaky gut? Or do they have Hashimoto's? I see that a lot, inflammatory causes. So I would say what really differentiates us, number one, it's the energy of this place, right? It's what they feel when they come in, right? And I get that all the time. People come in, they're like, oh, it feels so peaceful in here. You just got to see it. Beautiful courtyard, nice flowers, it's just an old historical home, right? And they walk in and it's not just a typical med spa. Like I said, like everything I bring into this clinic, it's a reflection of what I believe in, right? After doing research. And I would say, what differentiates us is the fact that we are able to offer so many different modalities of healing from inside out. You think you're coming in really to fix outside, but honestly, there's more, right? And sometimes I don't even take that patient if they have so much anxiety and depression about themselves, because they're never going to be happy. Right. So I'm like, you know what, maybe this isn't a good fit. And they hate that, like, oh, I want something. You just walk away. You're like, this may not be a good fit. Why don't we try this approach? And when you do that, they trust you. Because honestly, it's not about the money. And that's what differentiates. Yes, you got bills to pay. But for me, it's my reputation. I want to see results. So I think what differentiates us is, like, number one, we're cutting edge. I'm very blessed. God's given me the wisdom to know this is what I need to bring in. So I brought in this awesome device. I'm super excited about it. I have Dr. Joe Cleaver that helps educate my staff. Also, he comes in about once a month or every 3 weeks and really educates us on stem cells, exosomes, creating a matrix with PRF. What's the difference between PRF and PRP? I mean, my staff come in and they're like, we're learning so much, and they get overwhelmed, but they're so grateful. They go home and they start researching and they understand really the methodology of all the protocols that we put in together. We put together. It's not just about aesthetics. It's about aging. It's about how do we reverse the aging process, with internally as well, because that all, like, you can even take oral, like for instance sirolimus, you can put that as a topical as a senescent cell, because we have cells that are aging us as well. So those are some of the things that I say would differentiate us, is the fact that we offer really cutting edge regenerative medicine. That's the future. Peptides are $1 billion industry, if used right. So I would say, being not only the fact that we're using peptides, but we use it appropriately. Yes, I like GLPs. I use them, but we're not a GLP. We're not just doing semaglutide and tirzepatide and retatrutide now, right? We're doing things that are going to optimize your mitochondria, that are going to optimize your neurotransmitters. They're going to optimize your gut. So if you go out and eat, it doesn't matter. Your body fat percentage still stays the same. There's no such thing as a fast or slow metabolism. So I would say that differentiates us. I'm looking at your whole body as a whole. I'm even looking at delivery systems that are more bioavailable. And what makes me feel so blessed is the fact that I can go to these conferences, learn about even just a typical bio, available system that's available, and be able to offer it to my patients right away, right? Because I have those sources. So that, I think, is what really differentiates us. If you want cutting edge, come to the clinic. And if you want something, you want to research something, I'll find a way to get it. That's that's the cool thing about what we do here.
Now, for people who don't really understand regenerative medicine, wellness, peptides, and all that, what would you say what is the situation that your patients would have to be in for them to start looking for solutions like yourselves? Like, I would assume it'd be people that have tried all these different things, have tried drugs, have tried surgery, they still have pain, they still have these issues. And it's almost like, not to put this negative, but almost like you're their last stop, because they've tried everything else and it's all failed. And so now
that's a good question.
Like, what is that situation where most of your patients are in, where they really need to come to you? They should have come to you earlier, but they've come to you later on because they can't figure out a solution.
Yeah, I mean, right before surgery, like, oh, I don't want to go under the knife. I know that there may be another option. They've already done the research. PRP, PRF's already pretty well studied, for injections, joint injections, but now I'm combining that with, exosomes, if you would choose to do that route. I would say, prior to surgery, having a tear, bicep tears, we do a lot of that. But even those that are chronically inflamed, like CIRS, chronic inflammatory response syndrome, mold patients, Lyme patients, that have been to every doctor and say everything is normal. Or, I'm sorry, there's nothing I can do. You just got to go on disability, and it's terrible. It's not right. I don't take a lot of those patients, because it's a lot, right? It's so I refer, but I can get them to feeling better. But it's not. It depends on the level and how long they've been feeling that way. So I would say it's usually those people that have been chronically ill, that have been from doctor to doctor. And I don't want to name names, but really, I would say that people have given up on, like the misfits, right? They just say there's nothing we can do. And I don't cure anything here. My goal is just to get them to feel better. Again, this is more of a med spa. It's a wellness clinic. So really my goal is, our typical patient here are more of like the longevity patient that just like, hey, I'm feeling pretty good, but I want to feel good forever. I want to start bodybuilding. I want to start powerlifting, so those are some of the things that we can kind of help you do. I have cognitive decline. I have Alzheimer's in my family, Parkinson's. Like, how do I prevent that? Is it genes or is it more chemical imbalance? So those are what are the things those are some of the patients I would say are our ideal patients, those that have a history of chronic illness and family that are really trying to prevent that.
So I think that your practice sounds like you're really focusing on the beauty outside and inside.
Yes.
I think most aesthetic practices mostly focus on the outside. More and more I'm seeing now starting to bring in regenerative medicine or functional medicine, but it's almost like you already had that from the beginning. So from the beginning, it was inside and outside, really trying to maximize your beauty.
Always. I mean, beauty comes inside, right? It just flows when it's inside you, right?
Yeah.
You're just bringing it out. That's all.
That's a great way to put
it. 100%. Thank you.
Now, I'm sure that you have a lot of misconceptions. When patients come in, they think one way, whether it's right or wrong, about certain treatments, certain procedures. So what are some of the most common misconceptions you hear about from patients coming into your practice?
It was just this morning, I would say, it's like, everything's normal. They just had labs done and they said, well, my doctors say everything is normal. And I would say that's a big misconception because, what are you comparing that normal range to? That's an easy indication. That's why I started doing these so that I can learn a bit more about what I talk about in a consultation so they can, search for that. And kind of what I'm saying now is kind of repetitive. I've been saying this over and over again. Big misconception. The fact that drugs don't cause any side effects, that there are a lot of drug-induced nutrient deficiencies over time, high dose statins, what they can do, muscle and CKs, things like that, I would say is a big misconception. Fillers, nothing against fillers, but, overuse, it migrates, yes, it's good, but they're starting to feel that now and they're sick of it. They're like, what? Only so much I can do. It's not working anymore. What else? What are some other things I can do? So oftentimes it's just, sharing with them the different devices. We've come such a long way with regenerative medicine and aesthetics that I think aesthetics is now like, okay, well, what can we do now to help, repair and build collagen naturally? That's why we love using PDO threads, because it's regenerative medicine too. You're building collagen over time. I love using Sculptra. Those are some of the things that I also love to use. That's FDA approved for, for volume loss too, collagen building. Filler if needed. What I found was also combining some of our regenerative therapies such as PRF or Easy Gel, which is what we've done, and mixing that with Sculptra or filler. So you have that instant gratification of that volume, but you're also getting that mechanism of building, collagen naturally, right? So because oftentimes they're like, it went down, it didn't work. So actually I have this new technique now. It's called Celidus PRP. It's a volumizer. So you take the PRP and you create a gel consistency with it. And there's a filtration system now. So I just got that. And the cool thing about it is you just need 2 treatments. And it's a regenerative therapy that you can build lips with. You can build volume here. You can build volume in your hands and sculpt the face. And there's not a big risk of occlusion. So that's, I think, the future, and then they don't realize that you can combine that with Sculptra, or combine. I love to mix things, right? I'm a pharmacist. I love to put things together just to see how heat it up a little bit more. I'm a rebel. I'm always trying to find better ways. And so is Dr. Joe. And that's why I learned a lot of what I do is from him, right? He's a rebel too. He's like, okay, you're doing it this way, but he's a cook. He's always been in the kitchen. He's always trying to figure out, you heat things up a little bit hotter, or you filtration, you do a filtration, even just a little bit changes it, right? And that's what they figured out. So it's called PRP now, because there was PRF. Not everybody knows Easy Gel. If you're from LA or California, Easy Gel is the next biggest thing, right? But now you can do PRP as a gel form with a special filtration, and it creates volume. So I would say that's the biggest misconception, is the fact that they don't realize that you can get volume now from your own blood, which is cool. Yeah.
Okay.
Yeah.
And you think the future is really just regenerative medicine technologically getting better, 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 so the body can really heal itself?
Yes, 100%.
Okay.
100%.
Okay.
I mean, we do V cells, right? But you think about very small embryonic blood cells. I don't know if you've heard of that before. You take about 237 ml of blood. I mean, I can't make claims, but you can reverse or at least modulate the immune system, right? So how do you do that? Okay, well, clean up the cells first. I love intermittent fasting. I love red light therapy. I do a product called Clothomax, Dr. Joe has, with Visitin, Apiginin. There's quercetin in it. And it's the dosage, right? It's not just taking it, it's knowing the proper dosage. So there's actually a product that we have, it's called Clothomax. Totally forgot about it. That's a nice product that you guys could start taking. It's a senescent product. It removes what's called your zombie cells. So it's preparing the body for that extraction, right? So it's not just about taking PRP, taking your blood and spinning it and injecting it. We take that extra step and we get your body ready for that extraction. We get your stem cells activated. What's the best way to activate stem cells? Exercise. So I tell my patients, go to the gym. Come here 30 minutes after and you'll have the best stem. I love the gym. I live at the gym. I'm a gym rat, right? So I'm like, go make it a lifestyle. And they start to realize, and that's another topic, just resistance training. But honestly, that's what differentiates us, is the fact that we prepare the body. We can even measure, senescent cells based on certain tests. Like there's a really nice test I like called True Diagnostics and Infinity that can measure, your not only your rate of aging, but also the amount of senescent burden that you have. What are senescent cells? Those are cells that age us, right? So knowing that, preparing that, and then giving you the best therapy like stem cells or exosomes or your own blood with V cells will give you the best results.
Now, Mary, I'm sure that you've got a lot of tough cases that came to you over the years of your experience. Is there one story that comes to mind that is just a really, really tough case that you worked on, and how you were able to get them a successful outcome?
It's never the way you envisioned, right? You always have, high hopes for these people. It comes down to them, right? Like you're just guiding them. But I would say there's a couple. I mean, I don't know how deep you want to go, or a patient. She actually became an employee. She's okay if I share that. But she went to all these doctors and she's like, something doesn't feel right. But I went to all these doctors and everyone was saying everything is normal. She knew in her gut that something was off. So it was simple. I honestly just measured TPO. I measured thyroid. I checked 3T3, and she had Hashimoto's. And the doctors they don't realize that you can treat that. You can modulate the immune system with low-dose naltrexone or certain other peptides. Which I don't know sure if I can mention those, but there's ways to do that. And when and she's a nurse, she actually works for me now, and she was reluctant at first, but I sent her home. I said, do some research, right? Because the hospital usually, trains your brain to think otherwise, right? Especially if you're in allopathic medicine. And that, like I said, I'm pretty careful and I read people pretty well. So I meet them with where they are. But my goal is if I meet them here, they come here on their own, and then I meet them there. Does that make sense? I don't bring them up with my help, because I'm not better than anybody else. I'm just there. Does that make sense? I meet them there, and then they come up. And she did the research. She's like, okay, I'm ready to do what you wanted. And she felt so much better. So much so now that she's talking to all the patients about it. She's like, you got to do this. This is why I feel so much better. So for me, it's when it's transformative in a way that even without you, they're helping other people. And that warms my heart, because you know that your efforts aren't just improving that person's life, but other people's lives too. Because she now is a believer, and she wants everybody to feel the same way. And that's when people are going to follow you, right? Because you can relate to where they were.
Yeah, I mean, that's going to be your best advocate, is the one who's gone through it. They had the issue, they solved it, and they're your best advocates.
100%. And I love her. I wanted to come here full time. She's my star. Yeah, she's my star employee.
There you go.
Yeah.
Mary, what role do you believe creativity plays in how you approach patient care? I mean, from the wellness side, from the aesthetic side, because people think about medicine and you have this step-by-step procedure that you have to follow. But where do you think creativity plays a part?
I would say number one, right? Like you really have to think outside the box, but also follow structure and format, right? This is a medical clinic. You still have policies, procedures that you follow to prevent any errors. But most important is, looking at things from an objective view versus just, this is what they're telling me. The best thoughts come when I wake up in the morning. I think about that patient. I'm like, oh, this is what we need to do. I go home and I'm always thinking about the conversations. I reflect. That's why I love going home, my quiet home. I take my bath and I'm like thinking about, what are some other things that I'm missing? And you're not going to get everything in that one visit. But what's great about what I do is, I see them, on a regular basis, because oftentimes my patients, I do a lot of body contouring here. I do a lot of end-phase end sculpt. So they're here on a weekly basis, or they're here at least once every 3 months. So if they share something with me and I may not have an answer right there, I'll have one the next day, right? Once I have that time to reflect. And honestly, I don't know where it comes from, but it just, it's all knowledge and everything that you've acquired, through the years. And I'm so blessed that I'm able to, use it, when that patient is in front of you explaining what they're going through. And I would say creativity is number one. And I'm so grateful that I'm able to use. I ask anyone that I work with, they know, like I'm ambidextrous. I work, both hemispheres, but honestly, that's what I love to do. And even when you're looking at the face, you're sculpting that face. And I had no idea that I was going to get into aesthetics. I fell in love with it. I love symmetry now, and you want people to say, well, what do you see? I never tell people, and I try not to, like, I'm like, okay, you need some volume under the eyes. I try not to tell them that, but I always give them a mirror and I say, what do you see? What is it that bothers you the most? And I would say, they kind of help me, they guide me to stay creative as well.
I think that's a very, very good answer for a topic that's maybe not as commonly thought of when it comes to medicine. Now, Mary, what is your long-term vision for boutique wellness?
That's a good question. I actually have a partner that wants to come on. She's a primary care physician, 30 plus years. And this is my baby, right? So I started this in 2018 and she's like, well, I'm ready to leave, and she's got a huge following. She doesn't know aesthetics yet, but she's just like me, but I definitely see a synergy here. So what do I see? I love to educate, right? I love to travel, right? And I love to go to other practices to see what else is new out there. So I definitely see us growing. We're here in Winston-Salem. I think in a year we'll probably be in Greensboro, and then really develop these policies and procedures in a way that we can start franchising, right? But you have to stay focused and you have to still have growth, right? And that the key to that is, of course, like what you do is policies, procedures, and metrics, right? So you have to see, okay, well, this is what's working, this isn't what's working. And I would say, yes, I'd love to develop a franchisable model that, and education, right? So what I see with boutique wellness, and if you look at the website, you look at the home, it's an old mansion, it's a healing retreat. I would love for this place to be an educational facility where we can conduct IND studies, people can come here, practitioners can come here and heal. So honestly, I think I'm going to start, and I've done conferences before, you can look up Wakanda Renaissance Group. I've done other conferences. My partner, Dr. Joe, he owns a winery in Sonoma, and I put conferences together there where we put 20 doctors. This is the middle of COVID, right? Everyone's wearing masks. We did it, right? So I had a 5-star dinner. I had a Michelin star rated chef. I did a 5-course meal, and we did education around threads and stem cells and longevity. Right, because Dr. Joe, he educates. So people came to his property. I put that together. So I want to do that here. It was in essence healing the practitioner, educating the practitioner. So that's what I see. Not only are we going to expand, but I would love for this to be a center of education and healing for our practitioners.
Got it. Now, Mary, I have one last question, but before I ask it, I want to put people to your website at boutiquewellnessnc.com. Now, my last question is, what is the most important advice you can give to someone who's thinking about getting some type of either aesthetic treatment or something related to regenerative medicine or functional medicine treatment done, but isn't sure which provider to choose?
That's a good question. Do your research on the therapies that you want to do. There's a lot of NIH studies. I would do your research on the provider. Look up and see what kind of, what reviews do they have, right? And you can't control everything. Honestly, it hurts me when I have negative reviews. I'm open to that, and that's okay. I'm not perfect. Can't please everybody, but I would say, look to see who they are. Listen to what they're saying. Listen to their message. If they have a video, listen to them, and then do the research on your own. And say, you know what, they mentioned this. Let me see what this says. So I would say you're your best advocate. Listen to their message on their website. Hopefully they have a video, and then do the research. You always validate, you always check, right, what they're saying. And that's why I try to be really careful about what I say. I don't try not to make claims, because of course can't do that, right, in this industry. But that's what I was saying, and it has to feel right. If you resonate with that practitioner, that's who you should see. You'll feel it when you hear their message. I want you to trust yourself, trust your gut, right? That's their first brain, right? So, and that's what I would say is listen to their message and trust yourself.
Well, there you have it. Mary sharing her expertise. So, Mary, where can people contact you in your practice?
Sure. So you can check out our website. It's boutiquewellnessnc.com. You could look up Instagram. We're on IG and Facebook. It's Boutique Wellness, also NC. We're also on Facebook. We have a YouTube channel. It's called Live, Fit, and Thrive. You can check that out. I'm starting another one called Mary Martinez. I'm still trying to figure out what to do with that one. Everyone's like, oh, you should do your own YouTube. So I would say, Facebook, Instagram, Boutique Wellness, NC. You can just Google Winston-Salem, North Carolina. That's where we are right now. And then, you can schedule a consult with us. We do free consultations if you'd like, if you're interested in any therapies that we offer.
Awesome. Well, Mary, thank you for being on the show. Thank you for sharing your message. This is great talking to you.
Of course, it was a pleasure. Thank you so much for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.